Okay, folks. So, what do we think about when we hear the word viral? Go ahead,
Like
shout it out.
computer viruses or the internet?
Okay, go ahead.
Or like a flu or something.
That it spreads to people.
Exactly. Person to person is how viruses spread. What else can be spread that way?
Gossip.
Right, gossip. So we heard rumors. When is the last time that you've heard a rumor about someone having HIV?
I heard that my friend has it and I shouldn't share a drink with him.
Okay, so that's actually an example of bad information that's being spread. So just like rumors, we can pass good information and bad information, and it's really important to pass really good information.
What is HIV?
I was diagnosed with HIV when I was 23 years old, which was a year ago. So I've only been living with HIV a year now. After my initial diagnosis, I shortly thereafter found out that because my immune system was so compromised, that I was diagnosed with AIDS.
HIV stands for Human Immunodeficiency Virus, and it's the virus that causes AIDS.
I'm HIV positive. I've been HIV positive for 8 months now. My life isn't the same as far as, when I first found out.
When someone has HIV, their immune system isn't as strong as it was when they weren't infected with the virus, so they're not able to fight off sicknesses as easily as they could before.
We should be more afraid of, using a fork or drinking out of a glass that someone else has because, they could be giving us something that our bodies can't fight.
Who gets HIV?
Well, anybody can get HIV. It doesn't matter who you are, it really matters what you're doing. And you certainly can't tell that anyone has HIV by looking at them. Some people with HIV get sick and don't look well, but most of us with HIV, you can't tell.
And a lot of people are very surprised, and they respond, the response that you get from people is very different because they believe that either you're not telling the truth, you must be gay, or you're not, how did you get it because you're not a gay man.
HIV is an epidemic that disproportionately affects young people, women, people of color, gay and transgendered folks. These groups tend to be at a higher risk of contracting HIV because they lack access to vital information, education, and healthcare.
Young people don't want the education. They feel that if you're talking about it, it embarrasses them. They don't feel that they're the ones that could be affected by it.
Just hearing about how rampant HIV is within the age ranges of 13 to 18, knowing that I'm a part of that statistic, I felt a certain responsibility to be a voice and say something.
The transgender community is highly affected because they are out on the street or homeless or something, and they don't have accessibility to a lot of things that could prevent them, like health insurance and testing and condoms and things like that.
It's important to remember that it's not these identities that put people at risk, it's the behaviors that they engage in. So it's important to remember that it's not who you are, it's what you do.
I made a very poor decision, and it caused me to change my life.
I tested positive about 2 years ago, and I think that finding out, we actually talked about this last night, it makes you grow up a lot quicker. I think that it's almost like turning yourself around from like partying all the time and almost growing up and like doing things that people do in their 30s, like working out as often as you can, eating healthy, just really taking care of your body.
How do you get HIV?
HIV is transmitted through only 4 fluids: blood, semen, vaginal fluid, and breast milk. That's it.
That's from sex, sharing needles with the breast milk, a mother that's HIV positive, feeding her baby, and the possibility of her passing it on to her child through the breast milk. Everything else out there, like saliva, you can't get it from that. You can't get it from sweat. It has to be blood, semen, or vaginal secretions, or breast milk. Those are the only things that I can give to someone else to make them HIV positive.
Straws, forks, like sharing food, like that's not an issue at all.
HIV could be transmitted through getting a tattoo if someone's just using a needle that's not sterile, so it's a needle that's been used before. So if you're doing tattoos at home and one person does a tattoo and then someone else uses the same needle and the same equipment, or doesn't change the needle, they could potentially transmit HIV.
How does HIV work?
This is HIV.
This is a healthy T cell.
HIV attaches to and enters the T cell.
HIV converts itself to HIV DNA so it can enter the nucleus or core of the T cell.
The T cell dies as HIV DNA makes copies of itself.
The HIV copies leave the T cell and go on to infect other T cells.
HIV is a virus that's not curable. Once you have it, you have HIV forever. There are medications that people can take, but the meds often make people sick, and it doesn't cure HIV because there's no cure for the HIV virus.
After someone has been infected with HIV, it's likely that the virus will actually mutate itself or change itself. And when it changes itself, you may not be able to take the same medication that you used to in order to treat HIV.
You have to take your medication every day once it's prescribed to you.
I have to take meds every day.
How can you prevent HIV? Risk for HIV exists on a spectrum. You have your no-risk activities, you have your low-risk activities, and then you have your higher-risk activities. For folks, on the lower to nowhere end, those activities often include, fingering their partner, mutual masturbation, stuff like that. And then kind of like a step further is oral sex.
Oral, it's a minimal risk thing, but just being aware of if you have any open sores in your mouth and there's any open wounds on the penis or vagina or anywhere around, just being aware of that.
People ask me if it's better to spit or swallow when we're talking about oral sex. And advice that we like to put out there as health educators is that the only way to prevent yourself from contracting HIV is to actually stay away from the other person's bodily fluid. So that includes letting them come on your chest, on your back, on the sheet, just not in your mouth. So I like to tell people to get away from the volcano before it erupts.
Higher risk activities, those include vaginal or anal sex. Anal sex we tend to think about as being a higher risk activity when it's unprotected because there's so much ripping and tearing that goes on with anal sex.
And be prepared, because how many times have you gone to a party and ended up somewhere you didn't think you were going to end up and you aren't prepared? Well, just always know you need to be prepared.
Keep
and
your
there's
shoulder
always
back.
a Walgreens on every corner, so
exactly.
there's no
24
excuse.
hours.
I'm gonna do a condom demonstration. So what you wanna do is push the condom to the side before you open it so that you don't rip or tear it. Go ahead and open the package. You wanna make sure that the nipple part is facing upward. This is gonna make it easier to roll the condom down. So you just put it on the head of the penis like this. You wanna make sure you hold the top part, create a little bit of space so that the semen has somewhere to go, and then you just roll the condom down to the base like this. After you and your partner are done, sometimes the penis will be flaccid or it won't be hard anymore, and sometimes it'll still be hard, but what you want to make sure you do is hold the tip and then roll the condom down like this. And then when you take it, you want to be careful not to spill any semen on you. Twist it up like that and throw it in the garbage.
If you're involved in a sexual relationship with someone, you need to assume the risks involved with that, which includes assuming that they may have HIV. They may know it, they may not know it.
So if you could ask anything that you wanted to know, what would you ask?
Is it better to use 2 condoms?
That's actually a good example of misinformation. Using 2 condoms puts you at greater risk of contracting HIV or an STD. And the reason for that is because when you put on 2 condoms, you have more friction that occurs, and that friction makes it more likely that the condom will rip or tear. So it's important to know that 1 condom is all you need, and if it's used correctly, you won't have anything to worry about.
I'm going to do a demonstration of how to use a female condom. So you're just going to open the package. The female condom is a little bit bigger than the traditional condoms. What you're going to do is squeeze this inside ring, and you're going to just put it in the vagina. The muscles in the vagina will keep it in place. And then this outer ring is what you're going to lay on top of the vaginal lips, like so. And then when you and your partner have sex, the penis is going to enter in here. After your partner has come, all you need to do is when they pull out, twist the female condom like that, just to make sure that you keep all the semen in the condom, and then pull it out and throw it away. Men and women can also use female condoms for anal sex. You just want to make sure you remove that inner ring and then put it in the anus before having sex.
I want to know what lube is.
Okay. So there are 2 different types of lubes that you can have. You can have your water-based and your oil-based. Oil-based lube is not actually good to use on latex condoms. Water-based lube in general is good for sex in that it reduces the amount of friction that is occurring, which helps to reduce the amount of rips that can occur in the vagina, on the penis, or in the anus. And these can be small tears, they're not painful, but what they do is create portals for HIV or other STDs to get into your system.
We don't recommend that people use Vaseline as a lubricant because the oils in Vaseline can make a condom break.
You use that? Yeah, and sometimes they flavor it too, so it kind of tastes good.
I heard that you shouldn't use flavored lube.
Flavored lube is used for oral sex. You should not use flavored lube for intercourse or for having sex. A yeast infection can occur. It could also cause an outbreak in the anus. And what that does is increase your risk of contracting HIV because it creates entryways for the virus to get into your system.
Protect yourself at all times. Keep all your bases covered so you don't become a statistic.
The point, as it relates to relationship and dating and sex and all of that, is that you can still have relationships as a person living with HIV/AIDS. It's just a matter of you just sort of taking responsibility for your own health care and the health care of the other person.
In a way, I was kind of ashamed about having to talk about it with my partner, but he finally brought it up. And after that, our sex life was amazing because I think it was just getting over that hump is what I needed to be okay, I can do this then.
I feel that young people should know that having sex is okay and that there are safer ways to practice sex. That's what's important.
What can you do about it?
All right, class, so I have a special surprise for you today. This is Denise from the Broadway Youth Center, and she's going to talk to you all more about HIV testing and also about actually doing the test itself.
People are afraid of getting tested for HIV because there's so much stigma related to the disease, but also you have to open up and be really honest about your sexual practices with a complete stranger.
So thanks for volunteering.
Yeah, sure.
So how are you feeling about doing the test?
I'm kind of nervous.
Yeah, what are you nervous about?
I don't know. Like, I don't know what I would do if I was positive.
Okay, have you ever thought about it before?
A little bit.
Okay. Well, let me just give you a sense of what's going to happen with the test today. So what I'm going to do is ask you some questions about your sexual risk, your history, you know, what kind of sex you're having. I'm going to pretty much get into it with you, but I want you to know that everything we talk about stays between the two of us and will not be repeated. This test is also anonymous, so I'm not going to be using your name or anything like that, okay?
We should really talk to our partner about getting tested or knowing their status so that we can both have healthy sex. Healthy sex is the best sex.
So I'm going to go ahead and open the package. This is the solution that the test is going to sit in, okay?
Okay.
So what I'm going to do is just put it in there. All right, so this is what the test looks like. So what I'm going to ask you to do now is I'm going to ask you to take the test. You're going to take the top part and you're going to swab across your gums. You're going to go across your gums on top, same thing on the bottom, and then hand it back to me when you're all done, okay?
Okay.
Go ahead. Yep. Thank you.
Thank you.
So what we're going to do is we're going to put it in here.
Okay.
And then it will sit in there for 20 minutes. And when it's ready, I'll come and get you, okay?
A lot of people are walking around and they do not know. They have no clue. There are so many men that don't go to the doctor, period, for the flu. But you could really be sick. It could really be something serious going on with you.
So are you ready to see your test results?
Yeah.
Okay. Great. So your test result is non-reactive, which means that no HIV was detected. Do you want to talk about how you're feeling?
I don't know. It feels really good.
Okay. Great.
Youth are making up half of all the new cases of HIV. And until we start talking in a real, open, and honest way about this virus, we're not going to prevent HIV.
So what are you all going to do to stop HIV?
I guess we just make sure we stop people from passing on bad information.
You want to talk to everyone that you know, your friends, your family, anyone who's willing to listen, to make sure that they have accurate information about HIV. What other things can we spread that might be beneficial?
Like information like, you know, what doctors to go to, how to get tested, things like that.
Right, exactly. We can spread both good information and bad information. And at the end of the day, the most important thing to know is that you are responsible for the information that you spread.
You can call a hotline, you can read a book, you can watch a video, you can talk to someone who's got personal experience with it, but the most important thing is to just, if you've got a question, is to try and get an answer to that question.
Sir, do you have a second of your time? How well are you educated on HIV?
Excuse me, sir. How much do you know about HIV and AIDS?
Being an activist means taking things that I'm passionate about and making them a reality.
If I only help one person, if I save somebody's life, if I give voice to somebody, then it's worth it. And if that only one person is me, then that's fine with me too. And what I mean by that is that it's something strong and something powerful about standing up. You really have to become engaged in this issue. And I was looking at something recently, it was like civil rights was my grandmother's issue or my parents' issue. HIV is mine.
HIV is scary.
HIV is something that we could stop. HIV is familiar. It hits really close to home.
HIV is not only a personal issue, it's a public issue too.
HIV is part of our past and present, but it does not have to be part of our future.